for most of these people, they don't run into someone or they don't have a practitioner who has the skills and the success to say, look, I can take you from here to here. You just have to do what I'm telling you. And of course, you guys, and you have hundreds of doctors that use ozone, and everyone has the same experience. This stuff helps. It really works.
Welcome to the Healing Reset, a podcast where we look at the body as a whole system that is designed to heal versus a set of individual symptoms. You guys, we believe that you have the capacity to heal, and we're super glad you're listening. Today, we have Dr. David Minkoff on. He's been practicing medicine for over 40 years in the functional or integrative space for the last 20. He's the author of a book titled The Search for the Perfect Protein, runs a successful functional medicine clinic in Florida, and has personally run 43 Ironmans to date. This is just to name a few of his accomplishments at his clinic. He is not only treating severe chronic illness, but on the flip side, he works alongside elite athletes who want to continue down the path of peak health and endurance. This all gives him the authority to speak into our lives, no matter where we are at in our journey, whether we have a stamp of a chronic illness, whether we're healthy, whether we are an elite athlete. He believes our bodies can be brought back into balance, and that by working with an integrative practitioner, there is a way. Today, we'll dive into just that, chronic illness like cancer and autoimmunity, giving hope for us to heal. Thank you for coming on our show today, Dr. Minkoff. I've been following you for some time, and I'm just really grateful for the impact you have in the community of the integrative medical space. But for guests on this podcast, normally there's just one defining moment that moves them towards functional medicine in their career. Do you have that moment, or what was that one moment for you?
I do have that moment because I was not a sympathizer. My wife is a registered nurse, and she started going to seminars with this guy named Jeffrey Bland, who's known to be the father of functional medicine. And Jeffrey Bland has an IQ of 200 and a photographic memory, and he could read 2,000 words per minute. And he's one of these phenomenal, amazing people who, if you asked him where he got that fact, he would cite the journal and the page, and he'd read it 10 years ago, like one of these kind of people. And he started doing seminars probably in the late 80s. But by the early 90s, he was traveling around the country doing seminars on what he called functional medicine, which was very different than symptom-based medicine. And she went to one of his seminars, and he sold her that through nutrition and detoxification, if your body systems were working properly, you could get better. And along the way, she heard that mercury was bad. And she had, I think, 14 silver fillings in her teeth, which are mercury, 50% mercury. And so she decided to go to the dentist and get them out. Now, she's a podium level triathlete. She always cared about food. She was always very fit. And so she parades herself to this dentist in St. Petersburg, Florida, who had no equipment, had no know-how, but she came in there and said, I want this stuff out. And he proceeded to just drill it out. And a few weeks after that, she's got sick. And it started with thyroiditis, and then it went to hepatitis, and then it went to a weak arm, which was thought to be multiple sclerosis. And she, I was an emergency room doctor at the time, and I knew all the good doctors in the hospital. So I sent her to, first the endocrinologist, who said she had thyroiditis and her thyroid's functioning okay. So it's a little swollen and it hurts, but nothing to do. And then to the liver specialist, because she was complaining about pain over her liver, and her liver function tests were a little bit elevated. And then when she got weakness of her arm, we got up one morning and she was in the bathroom, went to brush her teeth, and she had trouble lifting her arm. And it was weak, and her glute muscle on the same side was weak. And I sent her to the best neurologist I knew. And he said, it looks like there's an autoimmune disease here, and we better put her on prednisone and interferon. These are two very powerful medicines, can be toxic medicines. And it sort of jolted me into like, this doesn't seem right. Like, I'm really good at heart attacks and broken hips and strokes and gunshot wounds and car accidents, because that's what I was doing for 15 years in an emergency setting. But I don't know anything about this. And so she proceeds to tell me about this guy, Jeff Bland. I go to one of these seminars. He's amazing. I get interested. I start reading about this stuff. We sort of accidentally got to a biological dentist who said she's mercury toxic, which led me to Dietrich Klinghardt and his courses on detoxification. And then on the other side, functional medicine. And so I applied the stuff that I learned to her.
Let me just ask here. So she's mercury toxic because when they removed the fillings, they did not do it properly. And so her body consumed the mercury from the amalgam fillings.
Right. So if you take a single amalgam filling and you weight it, it's about a half a gram.
Okay.
It's made up. So when the way you make a filling is you take mercury, which is liquid, and you add silver, copper, zinc, and it makes a hard thing that'll stay together. Everyone knows that mercury at room temperature is liquid. It boils. If you take water at room temperature is liquid.
Yeah.
At 212, it boils. It turns from a liquid to a gas. Mercury at room temperature is liquid, but it boils at 110. So
like
you
a
don't
cup
have
of
to
coffee, like a hot cup of tea.
160.
Yeah.
Yeah, 160 to 200. Boiling is 212. So, you have a hot cup of soup or a hot cup of coffee or tea or, it's going to boil the mercury. And when the mercury boils, it's going to aerosolize. It's going to turn from a liquid state to a gaseous state. Now, if you take, and to give people an idea of how toxic mercury is, it's probably the most toxic thing known. Maybe uranium is worse, but it's very toxic.
Mm-hmm. If
you took one filling and ground it up real fine, and you put it in a 10-acre lake, okay, that's big, 10 acres, and you had fish in there. And of course, the plants will take up the mercury and the fish will take up the mercury. The wildlife guys, the fish and wildlife, would put an advisory on that lake because the level of mercury in the fish is too high to eat.
From one filling.
One filling, 10-acre lake.
Okay, that's perspective.
Okay. Now, so you take a high-speed drill. A dentist takes a high-speed drill. That stuff's going to heat up. It's going to aerosolize. It's going to go all over. And there are dentists now who do it safely, but they put a whole thing in your mouth so that none of it can get out of your mouth into your palate to swallow it. And any dentist with any sense at all is going to have a complete hazmat suit. They're going to have a respirator and a whole suit because they're doing this all day long. They're at huge risk. And, if you look at dentists and they measure levels of mercury in their pineal gland in their brain, they're very high. And the rate of suicide and depression, all this stuff with dentists is very high because they get poisoned by the stuff that they're exposed to. So she has it done by a dentist who doesn't have anything, and she isn't protected, and the mercury spewed all over. And mercury can produce a direct toxicity, but it also can turn on an autoimmune condition where the person's immune system now gets confused about who's the good guys and who are the bad guys. And when an autoimmune condition, the immune system is attacking the good guys, which is you. So it attacks the thyroid. That's what thyroiditis is, Hashimoto's thyroiditis. Or attacks the liver. That's what that, but autoimmune hepatitis. Or attacks the myelin sheath in the brain. That's MS. So that's what happened to her. And then I learned how to do energetic testing and supplementation and detoxification. And so at these seminars that I went to, this is back in 1995, 1996. And I come home and I didn't like what the neurologist proposed. And I thought, let's try this. And over about 4 or 5 months, all her symptoms went away and she completely got better. And our friends are watching this stuff. And of course, we got interested more in the subject. So every month we were going to a seminar somewhere to learn chelation and learn more about nutrition and supplementation, all this stuff. And so our friends are watching this whole process, and they, one called me up and said, I have chronic migraine headaches. Can you help me? And another one said, I got ulcerative colitis. I've got rheumatoid arthritis. I got colon cancer. Can you help me? And I'm still working in the emergency room. Emergency room is shift work. I either work from 7 in the morning till 7 at night, or from 7 at night till 7 in the morning. And we switched off. So, 14 or 15 shifts a month. And I had some days in between where I wasn't sleeping. And I said, well, I'll be at my wife's a nurse, and she owned a home healthcare nursing business, and she had an extra room. So I said, I'll meet you over there at the clinic on Tuesday afternoon at 2:00. And, I don't even know if I could help you because I have a success rate of 1.
Yeah. Your wife.
My wife. We'll just play, we'll just play. And I wasn't charging anybody anything because I wasn't really sure I knew what I was doing. And it started to work. Like it grew very fast. And next thing you know, there was a 3,000 square foot space next to this where her office was. And we rented it and we renovated it. And I phased into that and out of the emergency room. And then that grew. And, now we have probably about 15,000 square feet, 60 employees. I think we have more toys and modalities of things for people to get better with than any place that I know of, at least around the country. And I was we were talking earlier, I was at the Bulletproof Conference this weekend. There must have been 300 vendors there, like 2 huge convention halls of people with different stuff. And I bought 3 new things to bring back here to experiment with, because these things are, a lymphatic massage device, which is terrific, and another kind of an infrared sauna. Just amazing stuff. Because now this field is growing, and you have innovative people who are figuring out solutions which aren't drugs, and they're not toxic, and they really can help people.
Well, and the whole point is to bring the body into balance to support the body, right? We want to lean into what we have innately inside of us and help the system heal. And so it's awesome to think that the momentum is growing and the momentum's there. What I love about your story is there's a pain to purpose element to it, right? And you had to sit on the outside and watch your wife endure this, but you were given the tools or the actual gumption to say, I want to walk beside you and help you. And you had the tools within you, which is a really neat journey to see how your life landed where it is today and how that began. It's very authentic. And I think of that with some of your patients walking in your doors. They're very used to symptoms, right? They have a symptom, they get a diagnosis, they have a symptom, and they're told, here, take this pill. Do this. This is how you will progress through this disease. And this will be your lifelong sentence.
It's so true too, because I had a guy today come in. So he's a new patient. He drives up to Tampa Bay, which is where we are, Clearwater, Florida. He drives up from Miami. He was a semi-pro football player. I mean, he was an athlete. He was a ranked tennis player. 25 years ago. He said he got married and he got lazy. And now here he's 53. He's very obese. He's got high blood pressure. He's got high cholesterol. He's got no energy. He's been prescribed 6 medicines, and he doesn't like how the medicines make him feel. But you can't walk around with a blood pressure of 200 over 120 or you're going to die. And he's got, we measure visceral fat. It's the fat that's in the belly. And good is probably under 10 and his is 26. And, he's got diabetes And he's a vegan, so he's eating almost all carbohydrates as his food. And when I said, why are you being a vegan? And he said, well, because I thought it was healthier. And so he's the doctor's solution for him was, I'll medicate your high blood pressure, I'll medicate your diabetes, I'll medicate your high cholesterol. And it turns out he was on 4 blood pressure medicines, which he wasn't even taking because he didn't like them. And they gave him, erectile dysfunction, and they made him tired. And, there's just like one thing after another. And I met with him for a little bit over an hour. And, I could give him solutions. In 6 months, he won't have any of this. He will get better. And at this point, he's very motivated, so he'll do it. But there are solutions, non-toxic solutions to the things that are killing people. It's cancer, heart disease, dementia. These are the big ones that are killing people. And, most doctors are just chasing this sort of pharmaceutical remedy, which doesn't really work. I'm not saying I'm against regular medicine, because like I said, you got to take your blood pressure medicine. You're going to die. You're going to have a stroke. You're going to have a heart attack. But my goal is to get them off of it so that he can actually regain his health.
Yeah, I love that. And that's where I think the pain to purpose is. It's like you walk through life, you see 13 doctors, you're in pain, you're frustrated, you see no light at the end of the tunnel. And then you meet someone who's willing to give you hope and give you that purpose again. And so that guy's a wonderful example of so many people listening right now, or so many people walking around. They're functionally unhealthy and functionally unsatisfied with the medication that they're on and how they feel on it, but they don't really know how to get off. You had mentioned one thing I really want to dive into today is cancer. You had mentioned that as being one of the top things that are killing people. And from 2017, there was a stat that about 40% of all Americans will be diagnosed with cancer at some time in their life. I imagine that's gone up since then. But can you elaborate on what that looks like from a clinic standpoint? And is there hope from your perspective, and how treatment even starts? Let's just dive into cancer as a starting place for chronic illness.
Okay. I have a great one, and he came in today too. Now, this guy, when I need some handyman work done at our house, like some shelves put up, or he just was working in our garage, and I have 8 grandchildren, and they all have bicycles, and they're all in my garage. And I hate a cluttered garage because I got a couple of motorcycles in there and some workbench space, and I don't like everything all over. So I called him and I said, can you rig up a system where we can get these bicycles? It's a thing that goes up to the ceiling. You can put the bicycles on this rack and they go up to the ceiling. So we got like 15 bikes going up to the ceiling, and you can walk in the garage and it looks empty except for the motorcycles. And then when you ride a bike, you push a button and the thing comes down. So it was a little complicated, and it's the ceiling's probably 14 feet high. So he had to go up on a ladder and do it. And he's really good. Like, he's really smart, amazing handyman. So he comes in here, he starts getting pain in his stomach, like really bad pain in his stomach. And he's got an insurance plan, and he goes to his insurance doctor, and they said he's probably got an ulcer. So they send him to the GI person. The GI person puts a scope down there, sees an area of his stomach where he's got an ulcer. They do a biopsy, and the biopsy shows that he's got a cancer in his stomach. Okay. And so he gets sent to the oncologist and to the surgeon. And the surgeon says, we're going to cut out your stomach, and then we're going to do chemotherapy. And it's going to be a little tricky because you're not going to have a stomach from now on. We're going to try to hook up your esophagus to your intestine. And you're probably going to be dumping. You may have trouble keeping weight because your food may not be absorbed, blah, 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 blah. And this is a really bad cancer, and you have to do this treatment, and it's your only option. And he's not into it. Like I'm not doing that. Okay. So he comes over here, and I meet with him, and I look at the biopsies and the various testing. And I said, my experience with cutting out a stomach to heal stomach cancer is that it doesn't usually work. That the cancer has very often gotten out of the stomach And what we find is that about 99.9% of the time, when you find a cancer that's been diagnosed, those cells are already in the person's bloodstream. So the so-called stage 1 disease, where it's local, except for skin cancers like basal cell or squamous cell cancer of the skin, if you have a breast nodule or a prostate nodule or a stomach or a colon nodule or a lung nodule, the chances that by the time it's being diagnosed or it's been diagnosed, that those tumor cells have migrated out of that organ and into the blood are very, very high. And there is no such thing as stage 1 disease. By that time, they're all over the place.
And so to your point, by cutting out the stomach, would it change the fact that the cancer is still very much in our body?
That's right. And it can land someplace else and he'll get a recurrence. It'll come back someplace else. So I looked at him and I tested him, and we sent his blood to a laboratory where they can look at the blood and find the circulating tumor cells. And we've done this hundreds and hundreds of times. And the lab, after they find the circulating tumor cells, they are able to analyze those cells and find out what kills them the best. So they test about 50 chemo drugs and about 50 natural things. Vitamin C and turmeric and ginger and vitamin D and all this stuff. If you add it to the cancer cell, will it kill the cancer cell? So you get a profile of what would work in this person. And while we were waiting for that to come back, we started treating him for things that boost immunity and help destroy cancer cells. So we do hyperthermia. We have something that'll heat the tumor cell up through the skin in his stomach to 106 degrees, and that stresses the tumor. We put him on a ketogenic diet. Tumors like glucose, they like sugar. We take them off all sugar. We give them high-dose IV vitamin C, IV ozone with ultraviolet blood irradiation. So, and we have, hyperbaric oxygen. And we have a whole thing that we do with them to build their immune system and attack cancer cells. So he said, I want to do this. I don't want to cut my stomach out. And he did this for 6 weeks. We didn't start we do low dose chemotherapy. We didn't start any chemotherapy on him. He wanted to try this first for 6 weeks. And, he did some spiritual stuff, and his daughter's with him, and they're very tuned in people. And I saw him back today for a recheck. And he had been back to the surgeon earlier this week. And the surgeon basically yelled at him, saying that the vitamins and things that we were doing were a waste of time, and he should just schedule the surgery and get it out. And we had done a PET scan early, and it showed the area in the stomach, but it didn't show that there was tumors anyplace else. It's not perfect, but it's a good start. So he basically threw the chart on the ground and said, get this scheduled because I'm furious with you. And you better go see the oncologist because we need to do a new PET scan and we need to rescope you because it's been a couple months and things could have changed. So he went to the GI guy and he got rescoped. She could not find anything in his stomach. She biopsied 2 places. The biopsy is going to come back tomorrow. They re-PET scanned him. They couldn't find anything on the PET scan. Now, this isn't a common case, but it is a case that does occur. Now, if he hadn't come to us, he'd have no stomach and he'd be on 3 to 6 months of chemotherapy. And he's a young 50-year-old, very, he uses his body as a professional work. He couldn't work on high-dose chemotherapy and no stomach. And he's already pretty thin, and getting food in, it was going to be a problem. And now he's like, okay, let's see what the biopsy shows. If we have to do the low-dose therapy, fine. We have a vaccine that we use against cancer also. He's going to be fine.
Because he has hope, right? He's got
more than hope. He's got results. No, he's got results. For most of these people, they don't run into someone or they don't have a practitioner who has the skills and the success to say, look, I can take you from here to here. You just have to do what I'm telling you. And of course, you guys, and you have hundreds of doctors that use ozone, and everyone has the same experience. This stuff helps. It really works.
Yeah, it's incredible. Yeah. So I imagine there's a listener out there saying, okay, that's a small percentage, right? That's maybe the minority. What about me? What about me? Is that possible for me? So do you see cancer being healed in your clinic as the norm?
Well, here's the thing. When you get someone who's got stage 4 cancer, so they have real cancer and it's gone to other organs, okay, it's a bad condition. Cure, in the sense of there's no cancer left in your body, is sort of on a level of a miracle.
Yeah.
Okay. It can happen. We'll take it. But on the practical side, can that cancer be controlled in a way that you can live and enjoy your life? Another 2 years, another 20 years, we don't know. All of us are walking around on the head of a pin. Mm-hmm. Kobe Bryant never thought that helicopter was going to hit that mountain on that day. He's at the peak of his life. He's got everything he ever wanted. No money worries, no worries about anything. And then it's like that. So when you wake up, it's already a good day. Okay? Because we don't know. So, and that's true for everybody. And so if you're alive and you feel good and you could do what you want, that's what we're going for. So, I say to people, I can't promise you a rose garden. But what I can tell you is that our therapies won't hurt you. They won't make your hair fall out and you throw up all day long and you feel like you wish you were dead because you feel so bad from the therapy. And I think that's a big thing. And we don't have 100% success, but we have a lot of success with people. And most of the people we're seeing, I wish I would have seen them like this guy before they were damaged goods. Mm-hmm. Because the cancer system in this country has not had good success in the last 40 years. There's very little real improvement in survival of any of the major cancers. Sometimes you get lucky and there's a lump and it gets cut out and it's okay. But in the real cancers, stage 3, stage 4 cancers, the results aren't very good. And when the raves that occur in the medical journals of, wow, we have a new blockbuster drug for prostate cancer. And then you look at what the costs of it are, which may be picked up by an insurance company, but still the costs are very high. And the guy lived an extra 1 month over the guys who didn't get the treatment. And that is like, wow, we really did something good. We're on our way to success. It's like, are you kidding me?
Yeah.
So that's where we're at. And that's what we battle. And I think that if people, they have to make an investment. It's an investment. And I'm going to change my lifestyle and I'm going to eat and I'm going to take the supplements and I'm going to come in the clinic 3 to 5 hours a day and I'm going to get the treatments. And most insurances aren't covering it. So they have to be able to get it together to do it. And some people go, they do GoFundMes and they figure it out. But, you want to at least start with treatments that are going to help you.
The profound thing that I think of through that is the name of the podcast, The Healing Reset, started from just that. It's a reset off of the typical, off of the norm. You have to reset your brain to accept something that's a different path and that still can provide management, control of the cancer, right? We might not, like you said, practically be looking at a cure in 30 days or 6 weeks, however long that first patient you spoke of lasted. But we need to reset our brain that there is a way to work alongside of our bodies that's different than the allopathic model. And it a lot of times can provide an easier outcome to our bodies in terms of, hey, let's not cut out our stomachs at the very first PET scan look. But another thing that comes to mind is a quote you once said, I heard you say, and it was in terms of treatment, you said, death by 1,000 cuts versus an atomic bomb when attacking an illness. And I just love that because you threw out a couple of therapies, which we can get into later in the episode. But it wasn't just like, hey, this one therapy is going to be your therapy. It's like you're a unique individual with a unique history and background and mindset. we're going to treat the cancer, death by 1,000 cuts. We don't just have one silver bullet. And I think that's a very realistic way to approach someone who is just like I said, they have their own fingerprint, right? We're all very different. We can't promise something from one chemotherapy or one procedure.
Well, it's interesting because a grape-sized tumor has about 1 trillion cells. So that's a 1 with 12 zeros.
Yeah.
If you have a drug, like a chemo drug, that will kill 80% of the trillion cells, you still have a tumor that's got 10 zeros after it. Like, the numbers are staggering. And every time you give the drug, you can knock it down some, but you're also knocking down your bone marrow and your gut. And these guys can't take it very many times. And so people get anemic and they get ulcers and they get digestive trouble and their hair all falls out. And their immune system gets killed off along with the tumor. And the chemotherapy is never going to kill the stem cells that started the tumor in the first place. And if the therapy takes you down where you have no immune system left, who's going to clean up that mess when you don't have anything left to do it? And so most people with advanced cancer do not die of their cancer. They die of the side effects of the therapy, which is no immune system, which means they get infection or they perforate an organ, and that's why they die. And on the cancer statistics, it's not a chemo failure. It's not they died of pneumonia or they died of sepsis. It doesn't go on the toll of, we just had another failed cancer treatment. So the statistics are very misleading. And so I think we do better than they do for many things, is that we're not killing them. We're giving them nutrition and supplementation and attacks at cancer that don't break them down. Vitamin C in high dose doesn't hurt anybody. Ozone doesn't hurt anybody, but it does attack tumor cells. High heat doesn't hurt anybody. It attacks tumor cells. Hyperbaric oxygen helps people. All these things help people. And so you build up the person and you get their, even psychologically, they're not just walking around like a dead zombie, like, how much more of this? They start to feel some energy and they start to feel some hope. And then they were like, geez, it's not so bad. I'm doing good. And then, if we're effective and the tumors start to shrink and go away, then it's like, wow, we did really good. Yeah. And I think that's what should first be done with people, not, radiate and burn and cut. It's poison.
Yeah. As a starting point, and then we have options. We're always thankful for options, but to be able to start supporting. And when you mention that these things aren't bad for people in general, it's like, that's something a healthy person can do. It's not.
Well, and we do it with healthy people. We have athletes, we have pro athletes that come in and they get IV vitamin C and they get they get ozone and they get, because it makes them stronger.
Yes. Yes. The next topic I really wanted to jump into was autoimmunity seems to be taking over America. And I wanted your insights on why.
We're programmed so that every cell in our body has a tag on it, a protein on it, which identifies me as me and you as you. So if you try to put some of your cells into me, my immune system is looking for my tag. So if my tag looks like this, it's supposed to look, so it lasers out there, sees something that's in the system, it lasers out there, it says this tag, that means friend, leaves it alone. So an E. coli gets through the gut lining and it's in the bloodstream and its tag is this one. Okay. And the immune system radars in on that. It's like, oh, that's bad. Attack. Okay. Or if, I needed your kidney, I'd have to, my immune system would say, it's got this tag on there and that's not right. And it would attack it unless you gave very strong medications to block the immune system from attacking it. It would attack it and it would kill the kidney. So that's how it's supposed to be. Now, the immune system can get confused. What if the tag looks like this? My tag looks like this. And there's glyphosate that attached to it. Looks different. What if mercury or lead or arsenic attaches to it? It looks different. What if there's been some kind of other poison where it's sawed off a little bit of it and now it looks bent and it doesn't look the same? Now it looks different. And then the immune system's like, well, that's not good. I'm going to attack it. So, it might attack joints. It might attack the skin. It might attack the colon. So you have ulcerative colitis. It can attack the sheath around neurons. You have MS. It can attack the thyroid. You got Hashimoto's. And so right now, the body we have so many foreign things in us which cause this reaction. And the food supply and water supply is so messed up that the things that we're taking in our body are now breaking down our barrier tissues. And so we have things that get across our intestine. There's a so-called leaky gut. That then the immune system sees those things and it's like, you shouldn't be here. And it starts making an attack on those things. And it gets the immune system ramped way up. And now it's on alert for anything. It's sort of like the infidels are coming over the wall and anything that moves gets shot.
When you talk about that type of assault that our body isn't recognizing our proper tags, where does diagnosis come into play? Because it's the same issue, right? It's our tag that now looks different, and it might express itself in Hashimoto's. It might express itself in MS. It might express itself in rheumatoid arthritis. So where does the diagnosis play? And does the diagnosis matter in treatment of autoimmune?
Well, on some of the panels you get it. So we look for antibodies against thyroid tissue, or we look for antibodies against, different tissues. And the rheumatologists have whole huge panels of this. Really, it's a symptom of the earlier problem, which is that there are leaky tissues and there are toxins and various heavy metals and things like that are in the body that are causing the reaction. So I don't actually care if I have, this guy has specific antibodies against against the melanin in the skin, and that's why they've got vitiligo or whatever their particular autoimmune disease is. I don't actually care that much because the underlying problem is basically the same thing. They have things in their body that shouldn't be there, and we have to get them out. And then we have to settle down their immune system. Then by doing that and fix their gut, and by doing that, their immune system will settle down naturally. And then in many times we can get it to go back where it's now acting sane again. It's not acting sort of crazy because it's trying to protect you. But unless you get rid of the stuff that triggered it in the first place, it's not going to stop. Because it's trying to help you. It's your survival.
It's an interesting thought. A lot of times with autoimmunity, the thought process is our body is working against us. Our body is attacking us. And not that is a complete wrong statement, but to go into a mindset of trying to heal while simultaneously thinking, my body hates me, my body is attacking me. Those are two very conflicting thought processes to open yourself up to a hope of healing from autoimmunity as a long-term diagnosis.
That's right. It's friendly fire in a war. The good guys get killed along with the bad guys because the guys who are shooting the guns don't know, have trouble. They think it's this and they attack it. So that's exactly right. But the body really is doing its best to keep you alive. And all these reactions that we see are its intention to do that. And I tell this to patients, as soon as we get those things out of you that are causing this, whether it's Lyme disease or mercury poisoning, the immune system isn't stupid. It's really smart. It's got 2 billion years of experience with trying to keep stuff alive. It will stop doing that. So if you get someone who's got a diagnosis of lupus or rheumatoid arthritis, and you handle the infections and the toxins that have caused that, what you see is that the ANA or the rheumatoid factor, the body stops making it. And in 6 months, the level goes down. And in 9 months, it's like, I can't find any rheumatoid factor, or I can't find any anti-nuclear antibody. Because the body's not making it, because it has no reason to do it anymore, because it was only doing it to help you.
Do you get the opportunity, and it sounds like you do, to discharge patients from that condition? Because it's thought of as a lifelong condition.
No, it's only when you figure it out, they don't have it, because their body the body's doing this to solve a problem. And if the normal medical approach to solving the problem is poison the immune system so it stops doing that. Now, that does two bad things. It gives you a poison that's hurting your immune system, but it also doesn't allow you to handle the thing that started it in the first place. It's left alone. It's wrong target. So maybe someone in an acute stage needs an they're like so crippled up with pain or whatever it is, and they need an anti-inflammatory or something like that. Okay, fine. I mean, I'm not against giving people relief as a temporary thing. But as soon as you work out what the actual real causes are and handle them, the disease goes away. I have a very cute patient. She's in her 60s. She looks like a little nymph. She's very thin and she's spry and she's fun. Okay. And she comes in with a diagnosis of rheumatoid arthritis. And she's on Plaquenil and prednisone. And she's got knobby fingers and she's having trouble walking. And her rheumatologist wants to add another layer of drug, Embril, or one of these really toxic drugs. And she's afraid. So she saw us someplace and she came in and she said, well, I want to try you guys. Okay. And so I worked with her, and she had a sedimentation rate of 60. So she's very inflamed. It should be like below 50. So she's very inflamed. She's got a positive rheumatoid factor.
You said it should be below what?
Probably below 15.
Okay.
15. And she's got a positive ANA. And her CRP, which is another inflammation marker, is sitting at like 35, and it should be under 1. So she's got hot disease.
Yeah.
And the medication that she's on isn't handling her. Okay. So we do our diagnostic process, and we find out that she's got a couple of parasites, and she's got some Epstein-Barr virus, and she's got 5 Lyme bugs, and a whole bunch of stuff. And we start doing our treatments. So she got IVs, and we sort of plugged her into our system with supplements to fix her gut and help her with inflammation and help her with the infection and help her with the toxic load. And over about 6-7 months, she's feeling better and better and better and better. And at 9 months, I said, she walks in and she looks great. She's off the prednisone. She's off the Plaquenil. She has no joint pain, and she's got plenty of energy. And I said, let's just repeat your studies. So we repeat the sedimentation rate, and it's like 3. And we repeat the CRP, and I think it's like 1.5. Went from 2035 or whatever it was to 1.5. We repeat her anti-nuclear antibody, and it's negative. And we repeat her rheumatoid factor, and it's negative. And she says, do I still have rheumatoid arthritis? I don't know. I don't think you ever had it in the first place. What you had is all this stuff that we just fixed. And you don't have that stuff anymore. And the body stopped making the disease because it didn't need to anymore. And you keep your nutrition, you keep your supplements, and check in with me once a year, and you should be fine. So she says to me, should I go back to my rheumatologist? And I said, I think you should for one more visit, and bring along your lab work that we did just last week and show it to him. And you say, doctor, you've really helped me. Look at my labs. But I had to stop the Plaquenil, and I really stopped the prednisone. But what I did do is there's a charlatan herb doctor down the street. And I've been 2-timing you, and I've been seeing him. And he wanted me to tell you that if you need any help with any of your other patients, just send them over there.
Send them on over.
Because they can get better. She never went back to them because she understood it, and I was just having fun with her.
But even the question of should I go back to my rheumatologist just shows how ingrained it is for us to do follow-up visits and stick in this model of medicine that doesn't always prove, sometimes rarely proves health, because autoimmune is one of those that is considered lifelong. You get it and it's yours. Take these medications. This will be a script that you fill every 30 days for forever.
Right. I was just at the Bulletproof Conference, and I was one of the speakers there. And one of the things that I talked about is that if you want to live a long time, there's certain things that you have to sort of design your lifestyle so that you don't get the things that kill everybody. Okay. So the number one killer, if you look on what kills more people than anything in the United States, the number one killer is heart disease.
Mm-hmm.
Okay. Like 700,000 people a year die from heart disease. They have a heart attack or heart failure and they die. Okay. And the second one is cancer. It's almost the same number. You could have cancer. And probably the third one that's the most stressful is like Alzheimer's. Okay. On the list, there's a few things in between, but the big things that really matter are those big three. But there's actually one more thing that should be on the list that isn't published. And the thing that's on the list that isn't published is what's called iatrogenic illness. Iatrogenic means doctor-caused death. And it's actually number one. It's like 750,000 people a year from botched surgeries, wrong medicine, reactions to stuff. And so I think if people want to pursue health, then you have to design your health so that you avoid getting heart attacks, you avoid getting cancer, and you use doctors properly. If you have a basal cell skin cancer and you've tried some topical things and it hasn't worked, well, the dermatologist can cut it off and it's going to be a cure. If you have an acute appendicitis, well, you better go to the hospital and get it fixed. If you have a kidney stone, you better go to the hospital and get it fixed. Because modern medicine has some amazing things that can be really helpful. If my patient calls me and they say, I've got chest pain and it feels like there's an elephant on my chest, I say, you get an ambulance and you go to the hospital and you do whatever they say. You get a clot buster or you get a stent or you get whatever, because these can be definitely life-saving and they're incredible, incredible technologies. But if you're going to the doctor because you've got diabetes, you're just eating wrong and you're living wrong, or you've got chronic pain, or you've got rheumatoid arthritis, or you've got, most of the stuff that people go, you got a cold and you go get an antibiotic, you are doing the wrong thing. And I think that's what we need to educate people on, is that this one pill quick fix, I got a pain, I take Advil, next thing you know, I got an ulcer, or I've got, whatever it is. It's just wrong thinking, and you can never get healthy doing that. And the society that we live in doesn't respect that at all, or even understand that at all, because everything is directed at pharmaceutical solutions, pharmaceutical and surgical solutions for things where they may be needed. But I think the discrimination and the understanding by the patient, by the person, is what is the right thing to do at the right time. Sometimes a chiropractic adjustment will cure back pain, and it's the right thing to do. Or a massage therapist can work out trigger points, and it's the right thing to do, and they're not going to hurt you. But as soon as you get into the medical field, there are very powerful things, and they can hurt you. And that's what you got to really be careful of. Yeah. So if the solution is a pill, well, better think that. I've got heartburn. I went and had my favorite Italian food, which I can't digest because the peppers bother me and the gluten bothers me and the whatever else is in there bothers me. And I'm going to go to the ad says, well, just take Nexium, the purple pill. It'll save you. Well, you take Nexium, now you're not going to absorb minerals. You're not going to digest protein. You increase your chance of stomach cancer. That is the wrong answer. The right answer is don't eat that food. Eat the right food that is compatible with your body, and then you won't have stomach aches. You will have actually saved yourself a lot of grief. But that's not the programming.
It's not the programming, and it's where this major reset needs to come into how we think about our bodies intuitively.
Right.
Do we believe that our bodies can heal? Do we believe that we should do that from a more, natural way? But there's ways to support that aren't toxic. And I think that's a consistent theme I'm hearing from your message that actually gets results. I mean, we're sitting here, you're how many years into the functional space? 20?
Yeah, a little more, 25.
And coming from an allopathic model or the Western model, you wouldn't still be in this if you hadn't seen people come through on the other side without introducing. And like you said, there is a time and a place. We're not here to say everything is wrong with the system, everything's broken with the system, but there's a better way.